Okay, so we're going to go through your medical history. Are you having any dental pain or discomfort at this time?
No.
Have you had any complications associated with previous dental treatment?
No.
The date of your last dental visit was about 6 months ago, correct?
Yes.
And then your dentist's name is Dr. Shiflett in Hoquin, Washington?
Yes.
Perfect. Do you have any swelling or sores in your mouth at this time?
No.
Do you have a dry mouth?
No.
And how stressful are your dental appointments for you? None, slight, moderate, or extreme?
None.
Perfect. Are you under a physician's care now or within the last 2 years?
No.
Do you go in for normal checkups?
Yes.
Okay. And then it says the date of your last physical exam was in February of last year.
Yes.
And doctor's name is Dr. Erickson in Aberdeen.
Yes.
Perfect. Have you ever been hospitalized or had a major operation?
Yes.
Can you describe to me those operations?
I had a meniscus removed in my left knee
Okay.
many years ago,
Okay.
and then I had bilateral knee replacement in 2015.
Okay.
I've also had a lumpectomy on my left breast.
Okay. Have you ever had a serious head or neck injury?
No.
Have you ever taken fen-phen or Redux?
Yes.
And were you under a physician's care when you were taking that?
Yes.
Okay. Have you ever taken Fosamax, Boniva, Actinol, or any other medications containing bisphosphonates?
No.
Are you on a special diet?
No.
Do you eat a well-balanced diet?
Yes.
Okay, can you describe to me what you would eat for breakfast in the morning?
Eggs usually.
Okay. And then any coffee, tea in the morning?
Yes.
And you drink, is it coffee?
Coffee.
Coffee, and do you use creamer, sugar?
I use creamer.
Okay. And then what about lunch? What is your typical lunch?
Some kind of sandwich.
Okay. And then dinner?
Meat, veggies, and a starch.
Okay. Have you experienced any recent weight changes?
Yes.
Okay. And what are those recent weight changes caused from?
Being locked down due to COVID in the last year.
Okay. We will make note of that. Do you have any issues with frequent urination?
No.
Any swollen glands in your neck?
No.
Do you use tobacco, marijuana, or any controlled substances?
No.
Is there anything else that you feel to be more at risk for infectious disease?
No.
Okay. Are you pregnant?
No.
Taking oral contraceptive or topical contraceptive?
No.
Trying to get pregnant? Nursing?
No.
Or postmenopause?
Yes.
Okay. Are you allergic to acrylic, fluoride, local anesthetics, aspirin, food, nuts, metal, sedatives, sleeping pills, gluten, penicillin, codeine, or laxatives?
No.
Sulfa drugs?
Yes.
Okay. And can you describe to me what happens, like you get an allergic reaction to sulfa drugs?
Yes. My face gets flushed and I break out in a rash.
Okay. Are you now taking or have you taken any of the following medications during the past 12 months? Any antibiotics or sulfa drugs?
Only for my pre-med for my
Is
dentist.
that amoxicillin?
Yes.
Okay. Anticoagulants?
No.
Corticosteroids?
No.
Insulin or diabetic drugs?
No.
Nitroglycerin or pain medication?
No.
Prescription medication?
Yes.
And that is your antidepressant, right?
Yes.
Okay. Duloxetine hydrochloride. And you're still taking that every third day, correct?
Yes.
Okay. herbal, vitamin, or dietary supplements? You have listed vitamin D, zinc, and melatonin.
Yes.
Over-the-counter medication, you're still taking aspirin once daily?
Yes.
Perfect. Any other drugs, vitamins, or supplements not listed?
I do believe I forgot to tell you that I have been taking tamoxifen
Okay.
and for 5 years, and I last took it September 23rd of 2020.
Okay. Okay. So now I'm going to ask you questions about your current health, whether you have had, or any of these following. So just go ahead and stop me whenever there is one that you have had or have now. Angina pectoris, heart attack, high blood pressure, mitral valve prolapse, asthma, emphysema, shortness of breath, adrenal insufficiency, AIDS or HIV, bruise easily, kidney renal disease, GERD, human papillomavirus, stomach ulcers, dementia, post-traumatic stress disorder, autoimmune disease, tumors or growths, glaucoma, osteoporosis, spina bifida, artificial heart valve, heart murmur, high cholesterol, pacemaker, breathing problems, lung disease, sinus trouble, diabetes, anemia, excessive bleeding, cold sores or fever blisters, hepatitis A, inflammatory bowel disease, ADD or ADHD, depression, psychiatric care, cancer.
I've had cancer,
Okay. And what type of cancer was that?
breast cancer.
Okay. And have you done radiation or anything for that in the past?
Yes, and a lumpectomy.
Okay. And how long was the radiation for?
I was 33 treatments.
Okay. Epilepsy, seizures, hives or rash, pain in the jaw joints, swelling of the limbs, chest pain, heart surgery, infective endocarditis, stroke, chronic bronchitis, persistent cough, sleep apnea, excessive thirst, blood disorders, hemophilia, blood disorders and eating disorders, hepatitis B or C, liver disease or jaundice, Alzheimer's disease, developmentally delayed arthritis, chemotherapy, fainting spells or dizziness, implants.
I've had the eye implants.
Okay. And when was that?
It was actually November, December of 20,
Okay.
and it was LASIK surgery with monovision lenses.
Okay. Parkinson's disease, tonsillitis, congestive heart failure, heart trouble, irregular heartbeat, anaphylaxis, COPD, seasonal allergies, tuberculosis, thyroid disease, blood transfusion, sickle cell disease, frequent diarrhea, herpes, sexually transmitted disease, anxiety disorder, drug alcohol addiction, artificial joints, plates, or pins. That was with your bilateral knee replacement.
Yes.
We mentioned that up above. And your pre-medication that you take. And then we mentioned your radiation treatment as well. Frequent headaches, organ transplant, or rheumatic fever. And then diabetes, no. Any condition requiring pre-medication marked. We said you're amoxicillin. Have you ever had a serious illness that I did not list above?
No.
Okay. And then we will get all your vitals. You are an ASA 2. And then we will have you sign this.
Okay.
And that's it.